Today I will be talking about heroin and opioid addiction programs. So, to give a little background on the heroin addiction, um, heroin is an opioid, and so it has morphine-like effects, and it's used for pain relief. Um, this kind of addiction is usually chronic. It's difficult to treat and associated with high rates of morbidity and mortality. It also requires the prevention of new cases, so it's hard to treat the existing cases, but new cases should be treated um, more easily, and prevention should be where it is targeted. So, one of the first steps of preventing addiction is through medical use. So, doctors should have to prescribe opioids more cautiously for pain. Um, so even though they kind of know this, opioid prescriptions have increased over the past decade. Um, they also there's also a need for prescriber education um, that corrects misperceptions. So some states passed mandatory education classes for doctors. Also, the FDA is now requiring some education for specific states. Um, they also want to reduce the ability to use these drugs orally, since that's mainly how people start their addiction. And so, another way that people tend to get addicted is through non medical exposure. So, these specific users were not prescribed the drug, but they got it from a family or a friend that was prescribed them. And so, something that's kind of needed is to change the stigma or perceptions about opioid use, because people will say, oh, yeah, heroin is bad, people shouldn't use heroin, but prescription drugs that are opioids aren't um, looked down upon the same as heroin. So, um, the stigma and the perception of it should change. So, another way to stop the addiction is to actually screen for addictive behavior. So, addictive behavior is such as like presenting early for refills, um, although this is hard to detect, obviously. Um, there's also urine toxicology, so they can run a urine test to see if what they've taken matches up with what they have, what they say they've taken has matched up with what they've actually taken. Although this doesn't account for how much they've taken in a period, and so this doesn't really work if people are prescribed the medication. There's also doctor shoppers. This means that people move around from doctor to doctor, and these people will ask their different doctors for the same pain relievers, and they'll go to whichever one will give them the medicine. And so these people can usually be identified through prescription drug monitoring programs, but they in the past they haven't been linked to treatment services, but instead have been turned away. So a good public health method would be to actually link these people up with some form of help, whether that be a rehabilitation center or treatment center. So once a person actually has the addiction, this can be managed through behavioral therapies. So the first one being cognitive behavioral therapy. This modifies users' drug use expectations and behaviors. It also manages their triggers and stress. There's also another kind of therapy called contingency management. This has motivational incentives for positive behaviors. So if somebody hasn't used in the past month, they'll get some form of incentive, such as like money or um, other forms. And this seems to be effective when used with medicine. And so another form of kind of treatment or help that people can receive is inpatient rehabilitation. So this helps eliminate environmental and social factors that could push them back to their addiction. It also provides them with a structured routine, and then also it allows for supervised detox, and so this helps lessen withdrawal symptoms. There's somebody there to help you walk through this process. So there's also medical treatment for overdose. For example, the medicine naloxone helps treat overdose. So it works by rapidly binding to opioid receptors and blocks the effects of the drugs. And this comes in three forms: injectable, auto injector, and nasal spray. Is becoming more available for at risk persons, um, family members, and first responders. So, in case they have a loved one or they know somebody that overdoses, they can administer it themselves. And also, pharmacists can have been able to give out this drug without um, prescriptions more lately. So it's becoming more available. So it's kind of becoming more over the counter drugs, which is convenient for those who do have an overdose. And so there's also drugs there's medical treatment for addicts. So two forms are buprenorphine and methadone, and these work by binding to the same opioid receptors as heroin but weakly. And so this reduces the cravings and the withdrawal symptoms once the person stops using. There's also naltrexone, which blocks opioid receptors and prevents the effects of heroin. So, getting into my analysis of the problem, I think that the most effective way of going about this is through prevention rather than just treatment, um, because it is such a chronic type addiction, and the side effects of coming off of this drug is severe. But yeah, so I think that really targeting the actual initial prescription of these strong opioid drugs is probably the most effective way to go about this. Um, and so just tracking people more about where they're getting their drugs, making sure that people actually take the full extent of their drugs or throw them out, um, instead of giving them to somebody else in their family. I do think that because there is still addiction, we do need to have good treatment, and I think that providing more people with overdose type prescriptions is really important, because this is kind of the way to help treat them and get them help. Also, when people come in to the hospital or whatever, they should be linked to a treatment center or given information. Also, the use of, if they're gonna use heroin through injection, use of clean needles, because HIV being passed is one of the um, one of the downsides, or very large downsides, to heroin use. It's one of the problems with it, side effect. And so I think making clean needles available is also important. And lastly, here are my citations that I used for this PowerPoint. Thank you for learning more about heroin and opioid use. Thank you.